Over the last 24 hours, we have identified 877 new cases of COVID-19 and completed nearly 8,100 tests. I'm pleased to see our new case numbers declining. This suggests that our public health measures are beginning to have an impact, thanks to the sacrifices Albertans are making every day. However, there is still more to do, and we have a long way to go. Our positivity rate currently stands at about 11.4%, and despite lower daily case numbers, has remained at this high level for weeks. This remains concerning. It's easy to forget that at this time last year, our positivity rate was about 1.5%, and this difference emphasizes why public health measures are still needed right now. Our hospitalizations remain high, with 691 people in hospital being treated for COVID-19, including 187 in the ICU. Sadly, I must announce that 4 new deaths were reported to Alberta Health in the last 24 hours. As I said last week, right now, second doses can be booked 3 to 4 weeks after the first for Albertans who are profoundly immunocompromised by calling 811. All other Albertans will have an opportunity to get their second dose about 3 to 4 months after their first dose. I know that this wait can be frustrating, but first doses provide good protection, and delaying the second doses is allowing us to vaccinate the province as quickly as possible, which helps protect all of us by further reducing the spread. Everyone who wants a vaccine will get one. No one will be missed. With more vaccines arriving every week, we are looking at when we can start offering the second doses. We don't have an exact timeline yet for when this will occur, but we will update you when more information is available. I'm happy to say that more than half of Albertans over the age of 12 have now gotten at least 1 dose. This is a significant feat and something that we should all be proud of. It is further proof that we are getting closer to the end and that things are getting better. The evidence on these vaccines is clear. They are effective and safe. They help prevent transmission and strongly protect against severe outcomes. However, our rates are still high, and more than 2 million people still haven't had their chance to receive a vaccine. That is why we need to keep increasing immunization rates in all age groups, 12 and over. What we know is that when someone receives a vaccine, not only are they protected because that vaccine, again, provides them with the immunity to, in most cases, prevent that infection and severe outcomes, but even after somebody's been vaccinated, in the small number of cases where someone who's vaccinated goes on to get sick, there's good research coming out of the UK now showing that even after the first dose, if someone ends up becoming infected, they have a lower risk of going on to have severe outcomes, and they also have a lower risk of passing the virus on to others. And so that's really what we're looking at when we're targeting that high level of population coverage, is to prevent the virus from spreading widely in the community. And if you think of it, I've talked before about trying to build a wall of protection against sort of a flood of the virus. And if you think right now about the fact that we still have very high transmission rates, still have very high positivity, and if you think of the public health measures as the current wall to prevent the virus from flooding into our communities, as we build up that vaccine protection, it needs to be at a high enough level to get to a point where the public health measures can be taken away, and that vaccine protection will provide the defense against that flood coming in and spreading widely and overwhelming the acute care system, and again, trying to use the vaccination coverage to protect people not only from the illness, but most importantly from those severe outcomes that happen.